Welcome to eCareDiary.com's Caregiver Tips and Clips. I'm your host Meghna Giritar. Each week we will focus on the caregiving issue in the form of a short educational video. The subject of today's video is breast cancer screenings and tests. October is Breast Cancer Awareness Month. Breast cancer is a disease in which cancer cells form in the tissues of the breast. Having a family history of breast cancer and other factors increase the risk. A lump in the breast could be an indicator of breast cancer. Breast cancer occurs when cells in the breast grow in an abnormal manner. A group of cancer cells invade surrounding tissues or spread to other parts of the body such as neighboring tissues and lymph nodes. Usually breast cancer either begins in the cells of the lobules, which are the milk-producing glands, or the ducts, which are the passages that drain milk from the lobules to the nipple. Screening is looking for cancer before a person has any symptoms to detect it at an early age. When abnormal tissue or cancer is found early, it may be easier to treat or cure. It is important to remember that when your doctor suggests a screening test, it does not always mean that he or she thinks you have cancer. These tests are conducted when there are no cancer symptoms. The first kind of screening test is always a physical exam and history. The doctor will usually check for signs of health or disease. Family and medical history are taken into consideration. Then come the lab tests where samples of tissue, blood, urine, or other substances in the body are taken. Imaging tests are other kinds of screening tests where pictures of areas are taken inside the body to give an idea of any possible signs of breast cancer. Finally, there are genetic tests that look for gene mutations or changes that could be another sign. If screening tests indicate signs of breast cancer, additional tests are recommended. A more detailed physical exam and clinical breast exam will be undertaken. The doctor will feel the breast and under the arms for lumps or any other unusual changes. Magnetic resonance imaging is another kind of test where a magnet, radio waves, or a computer is used to make a series of detailed pictures inside the body. Then there are ultrasound exams which use high-energy sound waves that bounce off internal organs to make echoes. A picture of body tissues called a sonogram is formed by the echoes. Mammograms, blood chemistry tests, and biopsies are other kinds of tests conducted by doctors post regular screening. In mammograms, an X-ray of the breast is taken. Blood samples are checked during blood chemistry tests to measure amounts of certain substances in the blood by tissues. In biopsies, cells are removed and examined under a microscope for cancer signs. There are 4 types of biopsies. An entire lump of the tissue is removed in excisional biopsy. Part of the lump is removed in incisional biopsy. Tissue is removed in core biopsy using a wide needle. Finally, a thin needle is used in fine needle aspiration to remove tissues. Here are some resources that can provide detailed information related to breast cancer. Breastcancer.org is a non-profit organization dedicated to providing the most reliable, complete, and up-to-date information about breast cancer. Susan G. Komen is an organization that addresses breast cancer on multiple fronts, such as research, community health, global outreach, and public policy initiatives to make the biggest impact against the disease. American Cancer Society is dedicated to helping persons who face cancer. It supports research, patient services, early detection, treatment, and education. Cancer Care is the leading national organization dedicated to providing free professional support services including counseling, support groups, education workshops, publications, and financial assistance to anyone affected by cancer. All cancer care services are provided by oncology, social workers, and world-leading cancer experts. Thank you for joining us today. To access more caregiver tips and clips, visit us at www.ecarediary.com. Until next time.